It was a long process and it was a lot of advocating on myself, and I brought about 5 pages of documentation.
It took Rosanna Gallant 11 years to receive a diagnosis for polycystic ovary syndrome, also known as PCOS. It's a common endocrine disorder that can cause irregular bleeding, ovarian cysts, excessive facial hair, and infertility.
I had my ovulating cycles down. I had pictures of what my facial hair looked like before laser. I had the documentation, every phone call I made from my doctor.
Gallant finally got a diagnosis in April, but now she's struggling with how to manage her symptoms.
When you go to the doctor, my family doctor, you feel rushed. You feel, what's the problem? Here's the solution. Here's the prescription. But it's not getting down to the root causes and listening.
A study published in the medical journal BMC Women's Health that was conducted in Alberta found that nearly half of people diagnosed with polycystic ovary syndrome don't receive follow-up care. This gynecologist in Moncton says she has a 6 to 8 month wait list for her private practice. She says many women are willing to pay for more timely care.
As it is, I have patients who went to the public care and they still come to see me and pay because they've been diagnosed, for example, with PCOS and had no information. So they don't know exactly why they've been diagnosed like that, why they've been given that medication.
Medical professionals say women's health conditions can often be dismissed, which impacts the kind of care they receive.
We don't talk about period health. So society in part is responsible. Medical education in the system is representative of what's important in society. And so in medical schools, we didn't emphasize it. And it's all because I believe it impacts women. And I think there is not just a gender bias, it's true medical sexism.
Singh is calling for change, which he says can start with recognizing that there's a problem and funding gynecologic centers that see women in a timely manner.
To say, you know what, we're going to research to find out how bad your wait times are while you wait for a decade in pain, that's not acceptable. So we need action.